told you, I'll be your marketing person.
That's right. So we're using a TENS unit. It's just a regular TENS unit around the knee. The knee's been replaced. How many weeks ago?
No, it was November 5th. So
November 5th. Today is January 3rd. So we're close to 8 weeks. She had a manipulation under anesthesia at around the 3-week mark, 3 weeks post-op. And so she's been pretty restricted to about 70 degrees of flexion. Working hard, doing everything right. So we're trying some different strategies to just alter the sensation around the knee. During the manipulation under anesthesia, the orthopedic surgeon said she was able to get 120 degrees. So we're gonna see if anything we can do can help her get back to that 100 plus degrees. So what we're gonna do today is we're doing this hydraulic resistance knee flexion extension. Her non-surgical leg can help and assist the surgical side, but you can see, so go into full extension. Yes, and then go all the way down. The tendency is to let that leg not touch the pads. So we've been doing both legs for a little bit. See if you can slip the left leg out, just all the way out on the side. And then just try a couple on the right. Kick it up. Kicking up is usually easier. And then pull it back down. There you go. So I'd say we'll do about 10 of them. Then we'll go back to both legs. And then from here, we'll keep the TENS unit on. We'll get on the bike. We'll do a little bit of rocking on the bike. And we'll go through a couple other techniques to try and use the TENS to confuse the nerves and gain a little range of motion.